June is Alzheimer's and Brain Awareness Month. It's a time to recognize the importance of improving brain health and other forms of dementia. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Tracy Umaki, a clinical neuropsychologist at the Queens Medical Center. Aloha and good morning, Dr. Umaki. Thank you so much for being with us this morning.
Thank you. Thank you for having me. I'm happy to be here.
So what's the difference between normal age-related forgetfulness and dementia?
So I want to first just by differentiating between dementia and Alzheimer's disease in particular. So dementia is more of an umbrella term that can be caused by many things, such as Alzheimer's disease. Dementia is showing changes in memory function or other areas of cognition. So when we look at the difference between age-related changes in dementia, oftentimes we'll look at the frequency of the cognitive lapses. How frequently are they happening? Is someone forgetting things quite often, or is it just kind of more intermittent? We also look at the severity of the cognitive lapses. Is someone forgetting things that should be well known to them versus something that maybe they've just learned. Also, if those cognitive changes affect function in daily functioning or activities of daily living, that might differentiate or cause more concern for a dementia versus a typical age-related change.
Okay, and how can a neuropsychologist help?
Sure. So a neuropsychologist, as a neuropsychologist, I specialize in the study of brain behavior relationships. So oftentimes I'll get referrals from neurologists wanting me to look at a patient's cognitive and emotional functioning more specifically. So I'll give specific tests that tap into different areas of the brain, looking at memory function, attention, concentration, and so forth. And with these tests, I'm better able to identify if there are changes in brain function, or whether that's related to a stroke or other types of injury or neurodegenerative diseases, or also differentiating if it is just normal age-related changes.
And as we focus on the brain, how can we improve our brain health?
Yeah, there's a lot of things that we can do for that. I think the best tool that we have in our kit is active and regular physical exercise. Obviously keeping in mind that we want to exercise within our own physical capacity. Safety is always important. Regular physical exercise increases blood flow to the brain, which can affect brain function. Eating a balanced diet, or perhaps a Mediterranean diet, or there's other diets that are well known to help support cognition. Foods rich in antioxidants, omega-3 fatty acids, good healthy fats are also good for the brain. Engaging in regular social activities, socialization, developing new hobbies or new tasks that are perhaps challenging but not entirely frustrating, but that's good for cognitive function. And also getting good sleep, practicing proper sleep hygiene, trying to get good, adequate sleep every night. That can also help support brain function.
Yes, wonderful advice, not only for those who might be struggling, but also just everybody. And to learn more about the services provided by Queens Neuroscience Institute, you can visit queens.org. Just click on services, then click on neuroscience, or you can call 808-691-8866. Dr. Umaki, thank you so much for stopping by this morning, sharing all this information. I think it'll help a lot of people out there.
Thank you so much. This is a pleasure.
All right, folks, coming up, we'll have a quick